RTI International is an organization that's 56 years old. We were the first organization in a research triangle park in North Carolina. Over time, we've expanded our global footprint significantly, especially over the last 2 decades. And currently we have projects in over 75 different countries around the world, ranging from very small projects to very large projects, addressing a variety of different issues in health, education, environment, energy, governance, and crime, violence, and gender inequality. Well, RTI has been involved in doing projects in India since 1982, and we've done projects across a wide range of areas. We've worked in the environment, we've worked in the area of education, we've worked in the area of health, we've worked in the area of civil society development and economic development. In the last several years, we've become more interested in establishing our own entity in India, and have worked on having a representative office here for the last 7 or 8 years. I've just recently converted that into a wholly owned subsidiary that we have here that is opening this week. We intend to continue to focus on India as a place where we'll do work with our partners. Right now we have a focus on cancer and health as a particular issue, but we're also working in the areas of sanitation, energy, and the environment, and we'll continue to work to expand those areas across time. India accounts for a disproportionate number of cases of cancer and number of deaths of cancer. And the deaths that are occurring, especially in relation to this particular conference in breast, cervical cancer, for example, are unnecessary, and that there are prevention strategies, there are screening strategies and treatment strategies that are available that could be implemented within the Indian context to lower those rates, to increase the rates of early diagnosis, to increase the rates of prevention, and lower the rates of mortality across time. I think this conference is bringing together an important set of stakeholders who are working on those problems from a variety of issues, from the funding perspective, from the research perspective, from the healthcare perspective, from the advocacy perspective, to come up with a number of recommendations, hopefully for driving the process forward, increasing the amount of resources that are put into cancer control, and cancer prevention in India, and improving the statistics remarkably, hopefully, across the next 5 to 10 years. We are involved in sanitation. We have a large project that's funded by the Gates Foundation that's called Reinventing the Toilet, where we started as a group of 15 different grantees several years ago. It's now down to us and another set of individuals who are now piloting a very low-cost, efficient system for placement in rural communities that would work without electricity, work without the needs for water, things like that. So our engineers, our lab scientists, as well as our social scientists and our international development experts have been working together in a large team to be able to do that. We're also working on maternal and child health issues here under the funding of the Gates Foundation as well. We have also been working in the area of energy with respect to the enhanced ability of electrical systems within rural communities. We are very much involved in establishing a broader relationship around clean coal technology, which we have piloted and worked on in the United States that works relatively well for a much lower cost point than previous clean coal technology. And we are obviously involved in the area of cancer and cancer prevention and control, and done several projects here with that. The other piece of things is in diabetes, and work in the area of diabetes control, early intervention, effective treatments, effective care within the health systems. So we've worked across a broad range of different things across time, and are interested in continuing in those areas, as well as bringing other capabilities that we have at RTI to bear on issues in India. For example, we have significant capabilities in the area of education, especially early primary grade education, enhancing the ability of young children to learn to read, of young children to learn how to do mathematics, which are really critical skills in the early grades. We also have education individuals who are working at the higher education level. And I've just gotten involved in a project with USAID to try to help with the newest Indian Institute of Technology here in terms of setting that up in a way that enhances taking innovations and taking the innovations from the point of discovery into commercialization, which is not just an issue in India, it's an issue in many, many countries who are trying to develop more of a knowledge economy that takes discovery to drive things forward, to change problems, but also to create economic development across time. An effective approach to cancer in India across the next 5 years would improve the amount of funding that's available for cancer prevention, detection, and control. What that would do is it would increase the screening rates. It would increase the preventive services available. You would see a decrease in mortality across time. And treatments that are available that have been discovered and utilized in other parts of the world would be able to come to bear on those individuals who are diagnosed across time. But you also have to think about the whole continuum of care here, which is from general prevention all the way to individuals at the end stages of cancer. And so the continuing support that individuals and their families need once you're diagnosed and once you're in treatment, hopefully will improve. One of the things that was mentioned this morning that I think is critical to all this, and it's critical to it worldwide, is the issues of tobacco control. Tobacco is the single #1 predictor of cancer. It's the single #1 predictor of mortality around the world. And if we don't continue to control the issues around tobacco and e-cigarettes, for example, which have now proliferated, and trying to understand that, we're going to have a hard time being able to stop some of the epidemic of cancer that's emerging in those areas. Cervical cancer in the United States, for example, if you want to contrast it with India, is much more under control because there has been screening that's been in place. In fact, what's happened in the US is the Preventive Services Task Force has recommended less screening in cervical cancer than there has been, because there's a large industry to some extent around screening and the issues around screening. There are technologies and innovations that are being developed to make screening much more efficient, much more cost efficient. We're involved in a technology with a partner at Duke University that would allow individuals who are less well trained to be able to get images of the cervix, to transmit those through smartphones and mobile technology, and to be able to utilize that as a method of expanding screening significantly. So I think if screening can be expanded and early detection and early intervention is expanded, you can see a significant decrease in the problems of cervical cancer in India. In cancer, we're working with the Public Health Foundation. We're working with the Institute for Cytology and Preventive Medicine at ICMR. We're working with the American Cancer Society here. The National Cancer Institute from the US has funded some of our work here. We've had some work from the commercial sector here, working with some of the pharma companies who have activities in India. So we have a variety of different groups from different perspectives, some government, some commercial, some entities outside of India, some inside India, who are working together with us to address these issues. The results so far is that we've done work identifying things within the health system in particular in both oral cancer and in cervical cancer that could be addressed through some fairly direct changes in terms of offering services in a different way, offering preventive services, offering treatment services in a different way, continuing to engage individuals to get involved in services, figuring out how to expand services by training individuals at a lower level to provide information about cancer, to provide screening and detection services, to link individuals into appropriate services. So we focus mostly on the health services system and figuring out what to do in the health services system to really optimize its ability to be available to individuals, and once they come into contact with the system, continue to engage with them across time.